Hello. I'm going to read something tonight. It's about, probably get into a combination of things, but in the last 2 weeks, I've come across a few things that intersected each other, and something came up about organ donations, and as a result, I came across things I never knew about, and not very many people do know very much about organ donations, except that it's a high price catch to get people to donate organs for when they're dead. So they make it look so innocent, so charitable, but people need to know everything there is to know to make a fully informed choice and what you want to do, and whether you really believe that this kind of an industry is really just. Now I'm going to read this article, and it's called Organ Donation, The Inconvenient Truth. I did take notes earlier, but I had to reboot the computer because this thing uses up a lot of my CPU. Anyway, I don't have my notes anymore. I'm going to read parts of this, most of it, and explain things as I go about things that just don't add up. Not just about this, but about other things too. So, we've got a population that is desperate for organ donations. This is by Dr. John B. Shea, and this is from the Catholic Insight magazine. It was published September 2007. Ever since organ donation after a declaration of cardiac death was first practiced in the Ottawa Hospital in June 2006, Canadians have been subjected to an incessant drumbeat of rhetorical manipulation in the media in favor of organ donation. The following commentary is offered in order to inform the public about the truth in regard to both the moral principles and scientific facts pertaining to both the donation and harvesting of human organs for transplantation purposes. Many physicians have serious and well-considered concerns about the morality of human organ transplantation and about the fact that the general public has not been properly informed about what really happens when organs are retrieved. The editor says, in July 2007, Britain's chief medical officer repeated an earlier proposal to make a patient's consent for donating organs a presumed consent in order to overcome a backlog of requests for organs. All patients, therefore, are counted as organ donors unless they specifically opt out. Now, for one thing, that is not fair to anybody. These guys and there's laws being pushed through in the US and other countries, the UK, to do this very thing, to make it that you are just automatically considered an organ donor, whether you want to do it or not. Once you're dead, they'll just take your body parts and they become their property. Well, that's what they want. That's what they think. And I think people who believe in human rights ought to put a stop to this attitude once and for all. They threw God out a long time ago with atheism and evolution. Yeah, and they want to become God. I think it's time to say, butt out. Okay? Your body is your own body. And it doesn't belong to governments, hospitals, or recipients waiting for donations. Sorry, it's not on. So these people want to presume that you're a donor. No ifs, ands, or buts about it. And if you don't go to hell and back to have something to show that you are not donating your organs, they're going to take them anyway. So all patients, therefore, are counted as organ donors unless they specifically opt out. In Ontario, 3 legislators recently introduced private members' bills with similar provisions. Under this regime, organ donations become mandatory, an extremely dangerous development. The following essay explains why. Pope John Paul II, addressing the 18th International Conference at the Transplantation Society on August 29, 2000, stated that vital organs which occur singly in the body can be removed only after death. That is, from the body of someone who is certainly dead. The death of a person is a single event consisting in a total disintegration of that unity and integrated whole that is the personal self. The death of a person is an event which no scientific technique or empirical method can identify directly. The criteria for ascertaining death used by medicine today should not be understood as a technical scientific determination of that exact moment of a person's death, but as a scientifically secure means of identifying the biological signs that a person has died. He further stated that the criterion adopted in more recent times for ascertaining the fact of death, namely the complete and irreversible cessation of all brain activity if rigorously applied, does not seem to conflict with the essential elements of a sound anthropology. This is only a superficially apparent endorsement. Let's see here. Ellen Schumann, Vice Chair of Neurology at the University of California, has stated in any attempt to define the unity of the organism as a whole versus multiplicity, a collection of organs and tissues, is in theory translatable from the philosophical to the physical domain. But he suspects that any attempt to operationally define organism as a whole with the goal of enabling unequivocal, non-arbitrary dichotomous categorization of all cases is an exercise in futility. Schumann also states healthy living organisms are obviously integrated unities. that decomposing corpses are obviously not unities, and that there is a fuzzy area in between that is intrinsically undecidable. The Church opens debate. The arguments of some that complete cessation of brain activity was not equivalent to death was apparently enough to persuade Pope John Paul II to reopen the debate 5 years later. Just months before his death, in April 2005, he asked the Pontifical Academy for the Sciences to restudy the science of death and scientific verification that those signs were still valid. Also, Pope Benedict XVI, the Sixth, has asked that this debate be reviewed. On September 14, 2006, Bishop Sanchez, Chancellor of the Academy, stated that the Academy had reaffirmed that brain death was equivalent to the death of a person. The debate is not over, however. Dr. Alan Schumann, a participant in the Vatican study in 2006, has stated that brain death alone results in a terminally ill patient, deeply comatose, but not a dead person. Bishop Sanchez said that he will have to wait and see from the Vatican. Now, in 2005, that was during the time that Terry Schiavo was being starved to death in Florida. In his message in the World Day of the Sick, February 4th, 2003, Pope John Paul II said, "It is never licit to kill one human being in order to save another." The Catechism of the Catholic Church states in paragraph 2296, "It is morally inadmissible directly to bring about the disabling mutilation or death of a human being in order to delay the death of other persons." Now this really gets to a part that stands out to me. You got the euthanasia warlords demanding that to terminate people, and get laws passed. And it's a well-known fact now that most of their executions are anything but consensual, and 50% of the executions in Belgium are not even reported. Okay? Now, so you've got this section of the population, or should I say the marketplace, marketing death. And at the same time, you've got this lubricated organ transplant industry wanting all the organs they can get. And because the organs sometimes they don't have a higher rate of success if the patient is really dead, there's a high organ rejection rate, but they found that with extracting organs before a person really is dead, that there is a high rate of a success in a transplant. But there you go. You're taking life to save life. And I know some of these big philosophers and utilitarians, they use this word utilitarian a few times in this document. But that you're supposed to do whatever's for the greater good of society. Well, you know what? I don't agree with that. We are all created equal in the eyes of God. God the Creator. Now, I know a lot of people threw God in the toilet They threw him in the dump back in the 1800s. Nietzsche, Freud, Margaret Sanger, Peter Singer, all those Jack Wardican. They threw God out a long time ago. So they want to be God, and that's what they're doing by railroading these kind of laws and these policies to get what they want, and the hell with the rest of us. So Pope John Paul II said it is never illicit to kill one human being in order to save another. The methods of organ retrieval. Today, organs are retrieved under 4 different sets of circumstances. 1. From a living donor, for example, a single kidney or part of the liver. This presents no moral problem, provided there is a properly informed consent and there is no major risk to the life or the health of the donor. Next one. From a person who is declared brain dead, and declared dead using the order criteria of loss of respiration and cardiac function, along with rigor mortis. Tissues such as bone marrow, corneas, heart valves, and skin may be removed. This procedure is morally acceptable. After the patient has been declared brain dead, that's the next one. And after the patient has been declared to have suffered a cardiac death, the moral status of both brain death and cardiac death is questionable. Theory and practice. Organs are obtained from an unconscious patient after he or she has been called brain dead, using clinical and technologically acquired information regarded as diagnostic. The public in general is not aware of the following serious criticisms of this kind of organ harvesting. The theory of brain death is highly controversial and can be used for utilitarian purposes. The Pontifical Academy of Sciences declared brain death to be the true criterion for death in 1985 and again in 1989. However, in February 2005, Pope John Paul called for more precise means of establishing that the donor is dead before vital organs are removed. Organ transplants, he continued, are acceptable only when they are conducted in a manner so as to guarantee respect for life and for the human person. The concept that whole brain death, irreversible loss of function of the cerebrum, cerebellum, and brain stem means the loss of integrated organic unity in a human being has been subjected to a powerful critique by neurologist Alan Schumann. Some physicians question whether we can be sure the entire brain is really dead in patients declared dead in the US by a whole brain, or in the UK by brainstem criteria. Neurological criteria are not sufficient for declaration of death when an intact cardiorespiratory system is functioning. These criteria test for the absence of some specific brain reflexes. Functions of the brain that are not considered are temperature control, blood pressure, cardiac rate, and salt and water balance. When a patient is declared brain dead, these functions are not only still present, but also frequently active. Let's see here. Come on. There is no consensus on diagnostic criteria for brain death. They are the subject of intense international debate. Various sets of neurological criteria for the diagnosis of brain death are used. A person could be diagnosed as brain dead if one set is used, and not be diagnosed as brain dead if another set is used. The diagnosis of death by neurological criteria is theory, not scientific fact. Also, irreversibility of neurological function is a prognosis, not a medically observable fact. There is also evidence of poor compliance with accepted guidelines of brain death. Utilitarian rationale. Brain death can be used for purely utilitarian purposes. In 2005, Dr. Robert Spemann, a former philosopher at the University of Munich, told the Pontifical Academy of Sciences that the brain death approach to defining death reflects a new set of priorities. It was no longer the interest of the dying to avoid being declared dead prematurely, but the community's interest in declaring a dying person dead as soon as possible. Two reasons are given. One, guaranteeing legal immunity for discontinuing life-prolonging measures that would constitute a financial and personal burden for family members and society alike. And two, collecting vital organs for the purpose of saving the lives of other human beings by transplantation. The goal is to move to a society where people see organ donation as a social responsibility, and where donating organs would be accepted as a normal part of dying. Oh boy, that sounds like the Bill 52 in Quebec. they've done it. They've finally changed that euthanasia is now a part of healthcare. And these guys in the organ transplant industry, they want the organs. It's mandatory, and you better jump to it to find out how to go about getting yourself off the organ list. And even then, when you're dead, nobody's going to know about it but them. You got to change the way people think. People really have to come up with a new thinking process, because the one they have is pretty barbarian. We used to be the developed world, Western world, but we're becoming barbaric, just like ours in the distant history. So these guys want to move to a society where people see organ donation as a social responsibility. Well, you know what I got to say to that? People need to take responsibility for their own lives, their own health, and their own lifestyles. Most of the organ transplants are given to people who are in accidents, traffic accidents, and stuff like that. They didn't take care of their eating habits when they're growing up. All through their life, they lived by self-destructive means in their diet and lifestyle, and then turn around and figure, hey, you owe me your diet, I want your organs. Well, screw you. In cases where a person chooses, oh no, what happened here? Oh no. I gotta open my file again. Huh. Yeah, that's it. Social responsibility. People need to take care of themselves. Do the right things. They wouldn't have such a problem with their organs given out. In case where a person chose to withhold recording a specific choice about donating his or organs, the surviving family members would agree to donation. In the U.S., federal regulations require institutions to contact local organ procurement organizations concerning death or impending death to ensure that the family will be approached at the appropriate time by a professional, skilled in presenting a proposal of organ donation. The Vatican debate. Bishop Fabian Bruskowitz of Lincoln, Nebraska, told the Pontifical Academy at its 2005 meeting that no respectable, learned, and accepted moral Catholic theologian has said that the words of Jesus regarding laying down one's life for one's friends, John 15:13, is a command, or even a license for suicidal consent for the benefit of another's continuation of earthly life. The bishop then observes that current technology enables doctors to monitor brain activity in the outer 1 or 2 centimeters of the brain. He asked, do we have then moral certitude in any way that could be called apodictic regarding even the existence, much less the cessation, of brain activity? In 2006, the Pontifical Academy published a statement titled, Why the Concept of Brain Death is Valid as a Definition of Death. Breaking protocol, several participants in a 2005 Vatican-sponsored conference on the ethics of declaring someone brain dead have published the papers they delivered at the debate. The publication of those papers, which the Vatican had decided not to publish, is evidence of strong feelings about brain death by a minority of members of the Pontifical Academy for Life. Robert DeMattei, Vice President of the National Research Council of Italy, told Catholic News Service on April 20th, 2007 that the concern of many is that the Vatican has not taken the appropriate position when doubts exist about the end of human life. The moment of separation of the soul from the body is shrouded in mystery, just as the moment when a soul enters a person. Harvard's oxymoron. The 1968 Harvard Ad Hoc Committee for Irreversible Coma published criteria that held that any organ that no longer functions or has the possibility of functioning again is for all practical purposes, if not in reality, dead. They then described the criteria for the diagnosis of irreversible coma and its concomitantly permanent non-functioning brain. They equated the state of coma with brain death and then declared the patient brain dead. They implied that brain death should be regarded as death because it inevitably leads to death, and that the person is in irreversible coma for all practical purposes, if not in reality, dead. Untold semantic confusion has followed this oxymoronic notion. I got something to say about that. There are a lot of people in hospitals around the U.S. and Canada, around the world, in coma. They're labeled persistent vegetative state just because that was the term dished out to Terry Schiavo. It was anything but a persistent vegetative state. And she was anything but in a coma. She had brain damage, but that was because she had beat the pulp out of by Michael Schiavo. And that never did go to court. But there are a lot of people who have limited brain function because they're in a coma and they're living in long-term care centers and or hospitals. And I think a lot of these coma patients could be brought out of it because there are many growing number of stories of people who have been in comas for up to 12 and 15 years and they came out of it. What I think needs to be done for a lot of these people, these patients, is they need therapy. They need occupational therapists, physiotherapists, to spend time with them each day, talk to them, let them have music, let them watch TV, and people go into the room and tell them what day of the week it is, what year it is, because these people are laying there, they're thinking, they're fully aware of what's going on around them, but people just treat them like they're just body bags ready to roll away. That's because the attitude of the medical establishment. I think it needs to change. I know there's a lot of good doctors. I know there's a lot of good nurses. I know there's a lot of good occupational therapists, physiotherapists, but from what I've seen of people around me, that is, got to be the same everywhere because the resources for healthcare are the same across the country and across the provinces, American states. They need people to go in, see them, tell them what day of the week it is, what month, what year it is, tell them something that's in the news, radio, television, let them hear music, treat them like human beings, instead of just trying to get them for body organs. And as far as the entire organ transplant industry, I know every time there's a fear that an industry might get shut down, and no more workers and stuff, no more budget, it's a big freak out. But I think what could happen with the organ transplant industry, it could be changed to getting developing organs from adult stem cells. I'm totally against embryonic stem cells. Totally against it. And but there's a lot of proof, a lot of evidence that adult stem cells have a lot of ability to develop organs and whatever people need. There's umbilical cord stem cells. People can get donations or ask for donations of umbilical cord donations, stem cells. That's, things scientists and doctors, They want to take care of all their patients to think about instead of organ harvesting. Okay, I'm going to go down here a little bit more. The deadly apnea test. Every set of criteria for brain death includes an apnea test, considered the most important step in the diagnosis of brain death. The ventilator is discontinued. Apnea is the absence of breathing. The only purpose of this test is to determine if the patient is unable to breathe on his own or her own in order to declare brain death. It aggravates the patient's condition and is commonly done without the knowledge or consent of family members. The ventilator is turned off for up to 10 minutes. Carbon dioxide increases in the blood, and the blood pressure may drop, indicating that cardiac arrest has occurred. The test significantly impairs the possibility of recovery and can lead to the death of the patient through a heart attack or irreversible brain damage. Dr. Yoshio Watanabe, a cardiologist from Nagoya, Japan, stated that if patients were not subjected to the apnea test, they could have a 60% chance of recovery to normal life if treated with timely therapeutic hypothermia, cooling. Note the similarity to cardiac death later described. Oh, wait a minute. It says, this is difficult reading. This Japanese doctor says, if patients were subjected to the apnea test, 60% could recover if they were treated with hypothermia. Some form of anesthesia is needed to prevent the donor from moving during removal of the organs. The donor's blood pressure may rise during surgical removal. Similar changes take place during ordinary surgical procedures only if the depth of anesthesia is inadequate. So here you got these patients who are supposed to be dead, but they're not, and there's no way for them to really prove that they are dead, and their bodies are going through all kinds of trauma as they would if they were wide awake. And as doctor says, that same thing happens if people having surgery if they don't have enough anesthesia. So think about it. These people being subjected to all kinds of trauma while their organs are being removed. Similar changes take place during ordinary surgical procedures only if the depth of anesthesia is inadequate. Body movement and a rise in blood pressure are due to the skin incision in a surgical procedure if the donor is not anesthetized. Anesthetized. Is it not reasonable to consider that the donor may feel pain? In some cases, drugs to paralyze muscle contraction are given to prevent the donor from moving during removal of the organs. Oh, how nice. They just shut down his muscles so you can get his organs. No consideration about the poor patient. Perhaps this is another reason why anesthesia and drugs to paralyze the muscles are usually given. Brain death has been used as a means for the moral validation of the retrieval of human organs for transplant since the late 1960s, and brain dead patients have been the main source of organs over the years ever since. However, demand for organs has increasingly exceeded supply. In 1993, a new way for categorizing patients as dead was conceived. According to a protocol developed at the University of Pittsburgh, a patient could be declared dead even though not brain dead if he or she was declared to have suffered irreversible loss of circulatory and respiratory function. The Institute of Medicine found that the so-called controlled non-heart beating donation, a typical patient would be 5 to 55 years old, would have suffered a severe head injury, would not be brain dead, would not be a drug user or HIV positive, and would be free from cancer or sepsis. This patient would be frequently unconscious as a result of car crash. Typically, the patient would be in an emergency department, in coma, and on a ventilator. If the physician decided that treatment was futile, he asked the relative's permission to withdraw ventilation and then for their permission to remove organs. If the patient's heart had stopped beating, the permission to remove organs if the patient's heart had stopped beating. Ventilation was then withdrawn. If the heart had stopped beating within an hour, the surgeon waited 2 to 5 minutes before taking out the organs. If the heart had not stopped beating within an hour, the patient would be returned to a hospital bed to die without any further treatment. How nice. Note that the patient's physician has a conflict of interest. The longer he waits, the less suitable the organs are for transplant due to damage from lack of oxygenation. The sooner the doctor declares treatment futile, the less chance the patient has of spontaneous recovery. These procedures are performed despite animal studies and clinical experience that shows even complete recovery of consciousness is possible several minutes after the heart stops, if resuscitative efforts succeed. This kind of resuscitation has been reported after more than 10 minutes of cardiac electric asystole in humans. The fact that the heart stops beating due to ventricular fibrillation, as occurs in a heart attack, does not indicate irreversible cessation of cardiac activity. The application of criteria for organ donation after cardiac death becomes questionable, since artificial circulatory and ventilatory support is sometimes resumed after death in order to maintain the viability of abdominal and thoracic organs in potential donors. Extracorporeal circulatory support can lead to return of neurological function in people who were neurologically intact before cardiac death. Finally, it is now widely known that a patient whose heart has stopped beating for 15 minutes after a heart attack can recover if he is treated by cooling the body to 33 degrees Celsius, cardiopulmonary bypass, cardioplegia, stopping the heartbeat chemically, and a slow increase of oxygenation for 24 hours. Up to 80% of these patients can be discharged from the hospital, 55% having a good neurological outcome. Clearly, the assumption made by physicians that a patient is dead 5 minutes after the heart has stopped beating is incorrect. An ominous and disturbing development is a recent widespread move to involve palliative caregivers in the organ donation process. Those caregivers are are set to provide skills and principles applicable to donation after cardiac death. In effect, they are to be the agents of a soft sell program to make the family feel comfortable and supported during this extremely difficult time. This movement is in keeping with the Institute of Medicine Report Brief 2006 on organ donation, opportunities for action. The Institute of Medicine Report goal is to move toward a society where people see organ donation as a social responsibility and where organ donors donating organs would be accepted as a normal part of dying, and in cases where a patient died without recording a specific choice about donation of his or her organs, that surviving family members would be comfortable giving permission. Well, that's not the kind of society I think we need. I think we need a society of better cures and less killing. Comment. Organ donation can be a moral good if the means used to obtain the organs is itself morally good. The circumstances under which this holds true have been described. The critical question is whether a person is truly dead when declared brain dead or to have suffered a cardiac death. The answer, in light of the scientific evidence, is that it has not been established. Cardiac or brain death criteria indicate real death of the patient with certainty. Mauro Cazzoli, writing about the status of the embryo, has stated, the uncertainty with regard to whether we are dealing with a human individual is not an abstract doubt regarding a theory, principle, or doctrinal position, tibium iris. As such, it is a doubt about a fact concerning the life of a human being, his existence here and now. As such, it creates the same obligations as certainty. The object of the will is to be determined by both the agent's motive and by the physical character, the integral nature of the external act. The physical and clinical realities of an action, whether actual or potential, must not be ignored or denied. Those caregivers in Catholic hospitals who administer levonorgestrel and abortifacient to a woman who has been raped ignore or deny the fact that it is impossible to exclude the possibility that she is ovulated and may be pregnant. Those who harvest organs after brain death or cardiac death similarly ignore or deny the possibility that the donor may be alive. Professor Joseph Seifert from the International Academy of Philosophy in Liechtenstein states that medical ethicists should invoke the traditional teaching of the Catholic Church that even if a small, reasonable doubt exists that our acts kill a living human person, we must abstain from them. The declaration of brain death or cardiac death is not sufficient to arrive at moral certitude. The recovery of organs based on that declaration is therefore immoral. That's a very good paper. I'm sure glad I found it. And answers many questions that I never even thought of before. I never really understood much about the organ transplant industry. I didn't really want to either. So, we got euthanasia in one hand, organ transplants in the other. I say shut down euthanasia, and Belgium has been chalking up euthanasia cases to steal their organs, euthanize them and grab their organs. They're really sick. Yet it seems to be there's people in Quebec and Ontario and British Columbia in this country that are all for it. One thing I will say, everybody's got to go to their grave sooner or later, including the people who had so much fun. That's the end of this one. Oh, it was a long one. Sorry, you guys, if anybody ever watches it. Anyway, have a good night. So, I'm going to read something tonight. It's about, I'll probably get into a combination of things, but in the last 2 weeks, I've come across a few things that intersected each other, and something came up about organ donations, and as a result, I came across things I never knew about, and not very many people do know very much about organ donations, except that it's a high price catch to get people to donate organs for when they're dead. So they make it look so innocent, so charitable, but people need to know everything there is to know to make a fully informed choice and what you want to do, and whether you really believe that this kind of an industry is really just. Now I'm going to read this article, and it's called Organ Donation, The Inconvenient Truth. I did take notes earlier, but I had to reboot the computer because this thing uses up a lot of my CPU. Anyway, I don't have my notes anymore. I'm going to read parts of this, most of it, and explain things as I go about things that just don't add up. Not just about this, but about other things too. So, we've got a population that is desperate for organ donations. This is by Dr. John B. Shea, and this is from the Catholic Insight magazine. It was published September 2007. Ever since organ donation after a declaration of cardiac death was first practiced in the Ottawa Hospital in June 2006, Canadians have been subjected to an incessant drumbeat of rhetorical manipulation in the media in favor of organ donation. The following commentary is offered in order to inform the public about the truth in regard to both the moral principles and scientific facts pertaining to both the donation and harvesting of human organs for transplantation purposes. Many physicians have serious and well-considered concerns about the morality of human organ transplantation and about the fact that the general public has not been properly informed about what really happens when organs are retrieved. The editor says, in July 2007, Britain's chief medical officer repeated an earlier proposal to make a patient's consent for donating organs a presumed consent in order to overcome a backlog of requests for organs. All patients, therefore, are counted as organ donors unless they specifically opt out. Now, for one thing, that is not fair to anybody. These guys and there's laws being pushed through in the U.S. and other countries, the UK, to do this very thing, to make it that you are just automatically considered an organ donor, whether you want to do it or not. Once you're dead, they'll just take your body parts and they become their property. Well, that's what they want. That's what they think. And I think people who believe in human rights ought to put a stop to this attitude once and for all. After death, that is, from the body of someone who is certainly dead, the death of a person is a single event consisting in a total disintegration of that unity and integrated whole that is the personal self. The death of a person is an event which no scientific technique or empirical method can identify directly. The criteria for ascertaining death used by medicine today should not be understood as a technical scientific determination of that exact moment of a person's death, but as a scientifically secure means of identifying the biological signs that a person has died. He further stated that the criterion adopted in more recent times for ascertaining the fact of death, namely the complete and irreversible cessation of all brain activity if rigorously applied, does not seem to conflict with the essential elements of a sound anthropology. This is only a superficially apparent endorsement. Let's see here. Ellen Schumann, Vice Chair of Neurology at the University of California, has stated in any attempt, they threw God out a long time ago with atheism and evolution. Yeah, and they want to become God. I think it's time to say, butt out. Okay? Your body is your own body. It doesn't belong to governments, hospitals, or recipients waiting for donations. Sorry, it's not on. So these people want to presume that you're a donor. No ifs, ands, or buts about it. And if you don't go to hell and back to have something to show that you are not donating your organs, they're going to take them anyway. So all patients, therefore, are counted as organ donors unless they specifically opt out. In Ontario, 3 legislators recently introduced private members' bills with similar provisions. Under this regime, organ donations become mandatory, an extremely dangerous development. The following essay explains why. Pope John Paul II, addressing the 18th International Conference at the Transplantation Society on August 29, 2000, stated that vital organs which occur singly in the body can be removed only